Thanks so much for joining us. I'm Jimmy McKay. I'll be your host of today's webinar. Really a conversation. We called it a webinar. It's not going to be as serious, but it will be very impactful. The Academy of Orthopedic Physical Therapy is excited to solve some of your frequently asked questions. Things around the idea of becoming an orthopedic clinical specialist. That's why you're here. You have questions, we have answers. And by we, I mean our guest expert today that we'll bring in just a second. We do want to make sure you know that we produce content like this on a regular basis. For no money, you can go and subscribe to the AOPT YouTube channel. You can do that at orthopt.org or just go directly to YouTube like most of you will. So feel free to subscribe over there. Now, some physics about this platform. I see some of you coming in live. Is this really live? Well, you can test me right now. Go below and drop a comment. Maybe let us know where you're from. Are you a practicing physical therapist? Are you a student physical therapist who's thinking about maybe one day becoming an orthopedic clinical specialist? So drop a comment below. This is meant to be interactive. We are, in fact, live right now, I promise. And the way you can check me is by dropping a comment. If you have any specific questions right now or during the webinar, feel free to ask those in the comments. We're not going to ignore you. We're actually going to answer some of those comments at the end of our set webinar discussion. So we see some comments coming in right now, and that's great. Jeff Seymour, looking forward to hearing from Jeff. Thanks, Greg. Mike Rhodes, PT from Kentucky. Devin, a PT in Wisconsin. Great beer, Leinenkugel out in Wisconsin. All right, I see a bunch of you already lined up. Again, if you have a question or a comment, drop it down below. And without further ado, and you know how much I do love some ado, your expert today answering your questions is an assistant professor at the University of North Carolina, director of the Orthopedic Physical Therapy Residency, board-certified clinical specialist in orthopedics, and a fellow of the American Academy of Orthopedic Manual Physical Therapists. That is a lot of letters after his name. We're going to cut through all that and get to your questions. Let's bring in our expert today, Jeff O'Loughlin. Jeff, welcome to your live stream.
Hello. How's everyone doing?
Jeff, we're going to go through the list of frequently asked questions, but they're what I like to look at them as frequent worries. And when you remove the worries, things get a little more clear. So it's all around the question, should I become an orthopedic clinical specialist? And if so, what other questions might I have? So let's jump in and ask about the prerequisites. This has got to be the first thing, right? The start from the start. What are the prerequisites and eligibility requirements for taking the OCS exam?
There are really two pathways you can take. One is you go through orthopedic residency program. By sitting and completing the orthopedic residency program, that satisfies the requirements to be able to sit and then hopefully pass the exam to become an orthopedic clinical specialist. You do not have to go through a residency program to be eligible to sit. However, then you do need to hit some of the other criteria, such as the number of hours worked in an orthopedic setting, including the number of hours, within the past kind of 3 years or so for that concentration. You really need to have over 2,000 hours in an orthopedic setting. And 500 of those 2,000 hours have to be within the last 3 years. And so you do have to have that clinical experience in that sense to sit for that exam. And then once you have satisfied those requirements, you need to apply for, sit, and then pass that orthopedic exam to then have that designation of orthopedic clinical specialist.
Perfect. Well said. Now, the next question that people are probably wondering about is, how long do I actually need realistically to prepare for the OCS exam? And I feel like an it depends might be in there, but I want to go deeper. I'm not going to let you stop at it depends. How much time would you realistically suggest someone prepare so they feel confident and competent and to do it well?
Well, to not mislead any of the audience, it does depend. And a lot of that is also dependent on the pathway you choose. So one way I also think about that is look at the deadlines for when you could apply and then when the exam occurs. The application is at the end of September and the exam is the end of February and then early March, that testing window. And a very reasonable expectation would be probably about that 5 months. A lot of programs from MedBridge to other OCS prep courses say they take about 20 weeks. Some of the more condensed courses I've seen are even as little as 8 weeks, but that also then depends on your bandwidth, how you are trying to study. Are you doing this in addition to your normal, 40-hour work week, your clinical practice, your other responsibilities and things that may be going on in your personal life? So you do need to know what your bandwidth and availability is. It is good to be able to pace yourself. Sure. And thinking about all of those things you have going in life will dictate where that's at, but a very reasonable time frame would be to allow it probably between that 4 to 5 month time frame, depending on how much time you feel you can devote to strictly studying for the OCS.
Great advice. Yeah. Sounds like a self-assessment and a life, where are you in life assessment? And then from there, work backwards from the test date. Let's move on, right? Whether you're climbing a mountain, running a marathon, or buying a house, it's all about the materials. What do I need to get to prepare myself? And I feel like the OCS is no different. So what study materials and resources might you recommend that would be an effective OCS exam preparation for someone?
Well, one great resource is the Academy of Orthopedic Physical Therapy. They have a number of very, very good resources. If you are a member of it, you have access to all the clinical practice guidelines, things like that, which are a great place to start. Another great resource is their independent study courses, specifically Current Concepts. Current Concepts is a series of monographs. There are 11 different regions, including clinical reasoning. But the Current Concepts are curated current best evidence that will take you through all of the different regions that will be explored on the exam, from diagnosis, evaluation, prognosis. It's 800 plus pages of material that works out to about just around 100 hours. It's 96 hours of continuing education. That is a fantastic resource. There are other great resources there as well. MedBridge has their own OCS prep course and their online platform for continuing education. There are a number of very good podcasts as well, from like the OCS Field Guide. And then I wrote down the names of the I want to get their names correct. So OCS Field Guide is, there are 2 PTs that like to do it, and they give them in very accessible chunks. It's Dr. David Smelzler and Dr. Austin Kirkville. I personally haven't listened to them when I went through my OCS training, but I do know a number of people that have, and they've all said very, very good things about them. And then there's also an OCS prep podcast from 2 other PTs, Dr. Alex Hutchinson and Dr. Amanda Everdeen. Those podcasts from people that I've known and have gone through it have said they are very, very good. And then naturally, as you do that, certain ones will also have some that are free or some that you can pay for additional resources. But that is where I would start.
Be prepared. Boy Scout motto right there. So we'll begin with the preparation. So a good list there. We do want to remind people, I see some questions coming in. I'm not ignoring you. We'll get to those at the end. I want to make sure we hit the high level stuff first, and we might actually answer some of those, but feel free to drop those comments below. Now let's get into the OCS. Let's get into help me understand the overview of those key content areas that the OCS is actually covering. It feels like we might be cheating a little bit, but you have to know and understand the test that you're going to prepare for. So this is a good thing. It might feel like cheating, but it's not. It's just good preparation. So what are those key content areas that the OCS will quiz you on?
Well, one of the nice things with the OCS is it does try to mimic clinical practice. Naturally, if you specialize in other areas, you might see more or less of that. But even if you're going through AbTree's webpage in the description of specialty practice, they will break this down for you percentage-wise by content area and then also tested by region. So for example, you're going to get more questions based on the lumbar spine, just based off prevalence, than oral facial pain or craniomandibular dysfunctions. So those exact percentages you can look up there, but I do have them here, so happy to share, so you don't need to go look for that. But I mean, the big areas outside of the geographic regions are going to be, you need to know your anatomy and physiology. Like everything falls back onto anatomy and physiology. You want to really know that. You'd want to be aware of things like movement science, pathology, pathophysiology, and also we see post-op and medical patients as well. So medical surgical interventions, things like that, how to rehab following those types of conditions, evaluation, diagnosis, prognosis, examination, intervention. These are things that we are doing all the time in clinical practice that you are going to then be questioned on in a standardized format to then feel that you have a strong grasp of that material and can feel confident in saying you are an expert in this subspecialty of physical therapy.
Great. Now people are going to get worried, or maybe it was just me hearing this, right? I know this might be it depends, but maybe some best practices. What study strategies or tips might you suggest for retaining and understanding this vast amount of information? I feel like that might be one barrier people might be nervous about out there. There's a lot of information. So you've done this yourself. You've helped people through this. What study strategies or tips might you suggest?
The one very good one is you aren't alone doing this. There's a lot of people that do this each and every year. It is a lot of information, and to perform optimally when that exam date comes, it is that Boy Scout model of be prepared or have that schedule laid out in advance. Know how you study and retain information. Some people are more kinesthetic. Some people are more auditory. Some people are more read, write, like repeat. Some people would want to be in small groups. Other people want larger groups. So it's not a one size fits all. It's really a knowing yourself and surrounding yourself in that type of community. Because if you're someone that does better independently or in a small group and suddenly there's 10, 12 people in a room and everyone's talking, that might not be as ideal a situation for you to try to retain that information. And then naturally, one of the best ways to feel that you have a firm grasp of the information is to teach it or create a scenario where you need to apply it. Yeah. So if you're looking at things that could be intervention or whatnot, it's, go to your coworkers, practice it. Hey, practice this. Can I show you this? Try to make it whatever makes it sink in for you. And also it is a lot. So you need to take breaks and you still need to do your own self-care. Like sleep matters. If you're someone that's an avid exerciser, that matters. Like you have to still do all of those things you need to do beyond just focus on this one test or this one task. You do want to be able to focus and devote sufficient time and attention to it, which it might rise up the order of priorities compared to other things, but you can't just neglect that other aspect of what's going on in your life.
Sure. So not just necessarily about the test. So we do want to remind people if they have questions, fire those away. We do have some people saying hi. Kathleen said she went to PT school with you, Jeff, saying hi. Yeah. Anthony from New Jersey, physical therapist. May from Tacoma, Washington. Noom saying hi to a buddy. And we'll get to some of your questions. If you're asking those in the comments below, we will get to those. But here's another question for you, Jeff, that you have some specialty behind. Let's talk about residency and fellowship programs. How might those types of programs enhance preparation for this OCS examination?
So one thing with the residency is it lets you, even right out of school, be able to then sit for that exam once you've completed the residency. So instead of 2,000 hours or doing those other different things, there are all those requirements. Residency programs can vary in size. Some are as small as just one individual, and others have multiple residents across multiple sites. But a residency is also curated information designed to help prepare you to take the OCS exam. So you have experts in your field, mentors that are going to spend time with you to help refine that practice, to bounce ideas off of, to discuss. If you have a cohort, you now have a built-in study group. Other people that have signed up for that same, year, 55 weeks, 13, whatever the duration of your residency program is, from, 10 months to, even longer, that have signed up to do that same thing. So take advantage of the other people doing the same thing. You don't have to go out looking for that. That's built in for you. From these are the things that we would prioritize focusing on, to, hey, looking at the evidence, the mentors, faculty of a program are selecting and providing some of that for you. So instead of seeking out what might be best evidence on your own, you have someone else who has developed that didactic or that curriculum for you. And then in any residency program, if you're trying to be an expert in clinical practice, having that mentoring and that feedback in clinic is invaluable. Yeah. So, being able to have those ongoing discussions throughout the year, that immediate feedback, that improvement of skill and application of that skill or evidence, is just invaluable.
Yeah. Yeah. Well said. Good insight. Let's talk about common challenges. Things are scary when we don't know they're coming, but we know something's coming. Or if we're worried about it over and over and over again, typically just learning about it can make it at least a little bit less scary. So let's talk about maybe common challenges candidates might face during their OCS exam preparation. What are some of those challenges, and how might you suggest they overcome some of those?
One of the biggest challenges is not making an appropriate schedule, because if it isn't scheduled, it's very easy to deviate from that, and then try to play catch up. And then when you play catch up, you feel like you just can't ever catch up, which leads to that, you could say that fatigue, that is a real thing. If you're already doing 40 hours of work, trying to do this on top of that, have your family life, if it's not built into the schedule, it's going to get pulled away. And then you're going to put extra stress on yourself. Other things I kind of alluded to earlier is it becomes that sole focus, where then you don't maintain those other aspects that let you stay balanced. Your social engagements, your sleep, your things like that. And also, people don't realize how much they actually know. You're going to go over that information, and when you're taking an exam such as this, you have to use the information provided. And everyone's most important tool is their brain and their clinical reasoning. And so when you're in those situations, the experts do the basics well. Yeah. So actually take a step back, read the question, look at the information you have there, and then reason your way through it. That can even be more during the exam than during the prep. But as you go through those different aspects of it, it is calm down, do some breathing. It can be cliche, but there are those breathing exercises that can change you from a more sympathetic state to a parasympathetic state to allow you to think more clearly. Chunking the information, what works for you, doing it in smaller amounts can be very beneficial. Then again, if your schedule doesn't allow it and you have to do it bigger, you need to adapt to what works best for you. But the biggest thing is going to be that fatigue. And also, if you're worried about it, take practice exams. There are practice exams out there to get an idea of what these questions will be like. And some of the prep material will give you more detailed responses than others. But things like MedBridge, they'll give you, after you take a practice exam, feedback on each of those different areas, where you did well, where did you struggle. So that can also let you focus a little bit more on areas that you want to improve. If I did a practice exam and did very poor in hip and did poor in hip anatomy, I might want to spend a little bit more time on that, as opposed to say I did really well on the knee, but I really like the knee. Well, if I'm naturally like the knee and I spend more time studying what I'm good at, you're making a strength stronger, but you're not helping the area that might help you overall. So it's being aware of your strengths and your weaknesses and using your time accordingly.
All right, this is the part of the video that we get to do some visualizations. Here's what I want people to do. I want them to visualize exam day. right? But everything that we just talked about with Jeff is going to help you, that stress level come right down. So the final thing would be, Jeff, what should they expect on exam day? Like, help them understand what that is so they can visualize it. So hopefully they feel a little more confidence so they take that. And then how can they best manage some of that stress? You mentioned a few ideas during the actual exam.
So one thing with that is this exam does take place in like the Prometric standardized testing sites. So you would want to sign up for a site close to you, but you may or may not be familiar with where it's at. So knowing where you're going and getting there early on exam day can make a big difference. And also knowing on exam day, it is a secure site. So you're going to go in, you're going to have to empty your pockets. You're going to have to not have your phone or anything else on you. And then also, since this is a standardized testing site, not everyone is taking the same test.
Right.
So you just focus on you and not anyone else can help. But I mean, it is a marathon of a test. You have 7 hours to complete it. You have 4 different blocks. Each block is 90 minutes. And you don't get to bank time. So if I finish block 1 early, I don't get extra time in a separate block. But between each block, you can get a 10-minute break. And between block 3 and block 4, you can have an even longer break. So if you're someone that wants to get up, stretch, move around, do it, do what you need to do for that. But, the best advice would be know where you're going, get there early. And then, come that exam day, that's the day to perform. But if you're looking at this as a 7-hour exam, you need to make sure you've eaten well, you've slept well, and that you can go in and you're trying to set that up where you can perform best. But it is a long exam.
Yeah, sounds like it. Yeah. Some advice from my former triathlon coach was plan your race and then race your plan. So everything leading up to that exam day feels like you're training just for that. And then hopefully exam day actually feels a little bit like a victory lap. Now you get to show off and actually perform all the things you just did for the previous preparation time.
And it is one of those exams that no matter how much you prepare, it is a hard exam.
Sure.
And you're not going to know everything, but you have the tools and the materials by your preparation to be successful for it. Over 21,000 PTs have gone through it. And it is a very nice thing, which, when you even think of the OCS or that amount, that might sound like a lot, but that is still well under 10% of the total PTs. I think in 2023, it was something like 6 or 7% are PTs that have earned their OCS. So it does put you into a more exclusive group, but it shows that it is doable. And there are those that have done it. So use them to help you and set yourself up for success.
Great motivation. All right. You okay with taking some questions from the audience that's watching and listening live?
Absolutely.
All right. Mike asks this. You mentioned the we'll say robustness of current concepts. Mike wants to know, hey, listen, do I need to go cover to cover and read all of the current concepts resource? What do you think?
So holistically, it covers all of that material, but you can also through the independent study courses, you could buy the lumbar spine or even the lower quarter. You could do cervical. You could buy specific monographs or look at specific monographs where you don't necessarily need to say, I want to do all of them. But as an entire resource, it is very good. It is something that I would encourage, but do you have to? Absolutely not.
Yeah. Good question, Mike. And again, we'll remind everybody watching live anyway, or if you're watching a replay on one of the platforms, feel free to ask a question. We'll see if we can get back to you later. This one we might, I'm not sure if you know this one, Jeff. This one seems new. Hillary wants to know, can you speak to the upcoming new initial certification requirements for the exam? I am not familiar.
So they are going to take place in 2026. And the biggest change with the requirements are going to be related to the hours. The 2,000 hours, they're going to want to see an actual breakdown by body regions that might mimic that exam more, where going through different things, you need to say, hey, currently I've done 2,000 hours or 500 hours in this setting within the last 3 years. well, what if I'm working in a spine center and I'm doing 2,000 hours primarily of lumbar spine, cervical spine, thoracic spine? Well, in 2026, they're going to want to still see that you've seen knees or shoulders or ankles and that you have that breadth. So those requirements aren't going to go into effect for this cycle or the next cycle, but they do go into 2026. There isn't a change necessarily if you're going through a residency program. And either way, once you've hit that the hours also by those body regions, you will then still have to apply for, sit, take, and pass the exam. So that's the biggest change in eligibility to sit for the exam, Hillary.
Good to know. Mike, Hillary, thanks for the questions. If anybody is watching live and has a question, I would ask it soon. One more thing I would want to bring up, Jeff, you did mention Current Concepts as a resource from the Academy of Orthopedic Physical Therapy, curated, updated every couple of years from some experts, the experts in orthopedic physical therapy. You mentioned this clinical practice guidelines produced by the Academy of Orthopedic Physical Therapy. Those are free. Access those now at orthopt.org. And the communications team, made up by Mariah and Amber and Sharon and Tara, have put together another resource. This is an entire page that we are adding to consistently with free and some membership benefit resources. If you're preparing for the OCS examination, you find this at orthopt.org. Just search OCS in the search bar there. That'll come up. And like this webinar that we're doing live right now, there are also some resources available through AOPT's YouTube channel, video-wise, as well as their new podcast, Orthostatic. So we appreciate there. Anthony, we'll get to your last question. How are the hours broken down by regions verified?
I haven't seen like the forms of that, but my understanding of what I have heard is that it's going to be more of self-reporting, and then when you submit your hours, you do also need to have it. If you're a staff clinician somewhere, you say I've done these hours here, and it gets sent to you could say your clinic manager to verify those hours. And that would also go into, I saw Devin had a question about maintaining OCS certification. That is going through that same MOSC platform, the maintenance of your specialty certification, where when you report those hours, you say, hey, I've worked in this setting, this for these dates at 40 hours a week, this equals 2,000 hours, whatever. And you need to include like your clinic manager or whoever to acknowledge that has taken place. Okay. I haven't heard that it's going to be any different than that. But again, we have about 2 years to wait and see as they come forward.
Hey, take it this year. You don't have to worry about it, right?
Yeah. And then even following up with that, Devin, with the OCS certification. So the MOSC, it's over the 10 years. You have 3 different cycles and then year 10. And in each of those 3 cycles, the intent of that is to not get to year 10 and then try to curate all the information you have. Okay. It keeps you current throughout to say, I've been doing this, staying current. These are my hours, these different things. And then if you've done that with each cycle at year 10, there is a 100-question exam that you take. But for the reaccreditation exam, it is an open book exam should you choose to do that. It's 4 blocks of 25 questions. You have essentially 2 months from when you start that block of questions, and then you complete those, and that then gets sent to complete that reaccreditation after 10 years.
All right, looks like we have about a minute left, so maybe we can get Jordan's question in there and sneak it in. Would you expect any significant changes in the maintenance process after certification? You're just talking about the maintenance process there a little bit.
Not that I've heard of. And so if there is anything in the works, I'm not aware of that at this point. That is, where it's going and going to maintain. But I actually don't know the answer to that, Jordan.
Okay. Sounds great. Jeff, a good 30 minutes chock full of things that I hope the people that were watching live and watching the replay are saying, okay, this is the tip of the iceberg. If you have any more questions, feel free to drop them in the comments below, and we'll see if we can get back to you with those answers. The resources that we mentioned are available now at orthopt.org. Jeff, a lot of information in 30 minutes. We appreciate your time.
Thank you. And if you have any questions, I'm pretty easy to find. If you have any specific questions for me, my email is my first name _ last name @med.unc.edu. So happy to help out anyway or answer any questions if you didn't get it answered today during this live stream.
Thanks so much. All right. On behalf of the Academy of Orthopedic Physical Therapy, thanks for watching.